If you're feeling a sharp stabbing pain from the pinky side of your wrist every time you turn a door handle, push up from a chair, or just do this action, then don't worry, you're not just getting old. It could be a TFCC injury. So in this video, we're going to have a look at what that is, how it may have happened, and most importantly, what you can do about it without needing surgery. So the TFCC is a collection of ligaments and cartilage that helps to absorb shock and stabilize the little finger pinky side of your wrist. So how do you know if you have a TFCC issue? Well, look for these three symptoms. The first one is pain on the gap between your ulnar bone and your hand. Come a little closer so I can show you exactly where I'm pressing. Okay, so on the little finger side of the wrist, you can see the bottom of my ulnar bone there, that sticks up. And if you just go past that on the outside of the wrist, there's a little gap there between your wrist bones and your ulnar. If it's painful when you press there, that's a positive sign, and there's a specific name for that test which I'll put on the screen here. So that's the first symptom, is pain in that indent just at the end of your ulnar bone. Now the next test is pain when you put pressure through your wrist in an extended position, as you may do of course when you're doing press-ups or pushing up from a chair. It can also be painful to fully rotate your forearm into this position or this position. At the beginning of the video, I mentioned that this movement may be painful, but sometimes you need to apply extra compression to see if that causes any symptoms in your TFCC. So what is the cause of this common type of injury? Well, there are usually three common culprits. Trauma could be caused by a fall on an outstretched hand. And if this has occurred and you have pain in your wrist, then make sure you go and get an X-ray to check for a fracture. The injury can also be caused by repetitive stress. Things such as constant twisting or heavy loading from gymnastics, work-related tasks, climbing or golf. And there may also be an anatomical cause. There's a measurement called ulnar variance showing on the screen here, and a slightly longer ulnar in relation to the radius does increase the risk of wrist pain due to impingement at this point. To identify this, you would need an X-ray. One important point to note is that pain in this area could also be caused by other structures and not the TFCC. One structure is the extensor carpi ulnaris, or ECU tendon, which comes alongside that little finger side of the wrist, showing on the screen here. And another cause could be entrapment of the ulnar nerve. And if you have that, you'll have nerve-related symptoms, which include pins and needles or numbness in your little finger and ring finger. So watch out for those symptoms, and of course, if you have any concerns, make sure you get a professional assessment to help you identify what the issue could be. So in this next part of the video, we're going to look at the treatment and rehabilitation. I've been a physiotherapist for 20 years and I've seen a lot of wrist injuries and looked at a lot of research in relation to this TFCC issue that we're talking about today. And the overarching advice is you need to rest from any aggravating activity for 1 to 3 weeks. And that rest is often in the form of complete immobilization. For some people with a little bit of irritation, they can get away from just reducing aggravating activities, but for many people it often gets so sore that they need to completely rest and immobilize their wrist. They can still use their thumb and fingers for their phone or writing, for example, but no sports or repetitive tasks or heavy gripping or lifting. And this is often what's required to let the issue settle down. So assuming you've had an X-ray and you have not got a fracture, then you're going to want to choose a correct wrist support. Now, if your wrist is very sore or you're having trouble just doing simple tasks such as holding cups or cleaning your teeth, then you may wish to get a hard wrist splint. This is the type of support that I'd usually recommend to immobilize wrists. It has this rigid metal bar in the bottom which provides some extra immobilization. It can go on either your right or left hand, which is always helpful. Space for your thumb there, and then the Velcro allows you to tighten it up and customize it, so a bit tighter or a bit looser depending on what you're doing or the time of day. And this will help to immobilize your wrist, but you've still got the fingers free so that you can still do things. This serves a couple of purposes. One is it reduces the wrist movement so that you don't move it by accident when you're doing day-to-day tasks. But it also serves as a reminder that you feel and of course see, so that you don't continue to just do things and ignore your wrist pain or forget about it. Even when people go to shake hands with you, for example, if you've got one of these on, they'll usually refrain and understand, whereas if you don't have one of these on and you don't shake hands with somebody, they may be a little bit upset. Might sound trivial, but little things like that can make a difference. So I'll put a link in the description to this type of device, but this is my go-to when it comes to wrist support and immobilization. That metal bar that I mentioned at the beginning is removable, and then that makes the splint less immobilizing, which can be good when you start to rehabilitate your wrist. This next type of wrist support offers a minimal but specific level of wrist support. You can see the strap is split there. There's a gap in the middle for the head of your ulnar bone to stick out of. And then using the Velcro and elastic, we can tighten the strap up to go nice and tight over the top of the ulnar head there. And then this lower strap can also come down and tighten up like so. So it allows your wrist to be a lot more mobile, but it limits some of those deviation movements of the wrist. Now, when you're wearing a wrist support that's quite restrictive, I would recommend taking it off 2 to 3 times a day so that you can gently stretch and mobilize your wrist. To do that, stabilize around the lower arm bones with a gentle squeeze, and then move your wrist in all non-painful directions. Don't move it in any painful directions, and if doing any of this is painful, then stop and make sure you get some medical advice. You may also wish to try some ulnar carpal glides, but do stop if you find this painful. To perform the technique, place your fingers on your forearm just over the ulnar bone to stabilize, and then place your thumb just above the wrist crease on the palmar side at the base of the little finger, so just here. And then gently press down with your thumb as you stabilize and provide counter pressure with your fingers. If you find this therapeutic and it reduces pain, then perform it for 30 seconds 2 to 3 times per day. So to begin with, take a small weight. I'm using 4 kilograms here, which certainly feels heavy enough for the beginning of the rehabilitation plan. And we're going to do some simple isometrics for the wrist. So if you think about a typical bicep curl, here the wrist has to simply stay in position. If we didn't use our wrist muscles, it would drop down like this, which would not be good. So keep your wrist in neutral and perform some bicep curls like this. You don't have to go all the way up, just up past about 90 degrees is fine. And this will start to strengthen those forearm muscles which stabilize the wrist. Then you can perform that with the palm facing up. It can be uncomfortable if you fully rotate into this supinated position, so maybe just partially there, so we're at about 45 to 60 degrees, and then perform some curls here, making sure you keep that wrist in a static, stable position. Then you can turn so your palm is facing down and repeat those curls. And this will activate the extensor muscles over the wrist, further enhancing the stability, but not moving the wrist, so hopefully these shouldn't cause any aggravation. Now, when you're ready to progress, we can start to do some more dynamic movement, starting with the hammer routine. And of course, you can use a standard hammer for this. But continuing on with the dumbbell, to start with, hold the dumbbell in the middle and have your elbow at about 90 degrees, and start with some forearm rotations, making sure that you can perform those without any pain or discomfort. And then you can hold and do some tilting actions. Just imagine you're pouring a jug back and forth like so. Then to reverse that, you want to get your arm up into this position, just stabilize it with your other hand, and then gravity will tilt the weight down and you can then lift the weight back up again. This movement, as you can see, is coming from the wrist, and this is ulnar deviation. Be extra careful with this one because this is certainly one which can aggravate, especially if you haven't yet recovered enough from the injury. That's the starting point. What you then want to do when you are able is to move your hands down and hold the base of the dumbbell. So make sure you're using a light enough dumbbell or of course a light enough hammer. So by holding it at the base, it makes it harder because of the weight distribution. So be careful when you first start with the forearm rotations. Here in pronation and then carefully rotating into supination. If this is not painful, then continue until you feel a moderate level of fatigue in the muscles in your forearm. Then stop, have a rest, do one of the different exercises, and then perhaps return to this 2 to 3 times more. You can then perform the downward tilt exercise. When you first start this, just perform a small range of motion And then as you increase the range of motion, make sure you keep control. What you don't want to do is suddenly drop down and let the weight drop your wrist fully into that ulnar deviated position, as this loses control and can cause a squashing and aggravation of those structures that are recovering. You can then pop the weight above your head, support the arm, and perform this ulnar deviation exercise. Another wrist strengthening device that I'd recommend is the wrist roller. You can buy these or even make one yourself. For this video, I also had a look on Amazon to see what else is available for wrist strengthening and came across this device showing on the screen and on my wrist here. So it's a simple spring device. You put your wrist through and you can perform some flexion strengthening. It's pretty good because you can hold it in neutral whilst the spring is trying to return you back into extension. So it certainly helps with stabilizing. And then you simply turn it around and you can use it then for strengthening up wrist extension. Now these gyro balls are the most interesting wrist rehabilitation tools that I've seen. Pull the cord to get them spinning, and then you've got to rotate your wrist with the correct rhythm in order to keep the ball spinning inside. If you don't do it correctly, the ball runs out of momentum and stops. So these funky rehabilitation devices are definitely worth a look at. Just make sure your wrist has recovered enough before you start to use them. And if you feel you need to work specifically on your grip, the exercises that I've just shown you will help with that, but you can get a simple grip strengthening tool. I have one around here somewhere, but I can't find it, so I'll put a picture on the screen here. These are inexpensive and they can help you to strengthen up your grip. Now, if you're looking to return back to the gym, here's some simple advice that you can follow. Firstly, you want to make sure your wrist is not pushed into extension, which can happen if you're using bars for shoulder or bench press. So instead, switch to using dumbbells. Therefore, you can keep your wrist in a more neutral position, whereas a bar would force it into extension. So dumbbells, not bars. And with press ups, or when you're in that press up position, make sure you use some press up blocks, once again, so that your wrist can be in neutral rather than into that forced extension position. And you should stick to this for a while until your wrist feels fully recovered. Depending on how well your recovery goes, it may be a good idea to stick to using press-up blocks and dumbbells as you progress into the future. If you do switch back to going into that extended position, if you feel any symptoms at all, then the first thing you should do is switch back to the press-up blocks and dumbbells. So monitor your symptoms and keep an eye, and don't ignore any niggles that may occur. I hope this video has been helpful, but we haven't quite finished yet, so stick with me. So remember, TFCC injuries can be stubborn and take time to recover. This is an educational video, not medical advice. I hope it helps. Please do share it with anybody else you know who may find it helpful. You've been watching the Physio channel. My name is Daniel Lawrence, and next up I recommend this video on taping for TFCC pain. It may give you some other options for reducing wrist pain. Thanks for watching.